Hi, my name is Yael Harris. I am the CEO of Laurel Health Advisors. We are a small women-owned business based in Washington, D.C. area. We do health services research and policy and consulting and economic analysis to support access and equity for underserved communities and vulnerable populations. So telehealth has huge potential to reduce health disparities. It increases access to populations that can't get to a doctor. They either live in a professional shortage area, they have difficulty getting transportation or arranging for childcare, or even working jobs that don't have the flexibility to get to the doctor. Also, individuals that are homebound or have disabilities and have trouble getting to the doctor. However, on the other hand, it can also exacerbate disparities because there are similar limited ability to access technology. People grow up without technology devices or can't afford a technology device that supports a video audio interaction. There's people who live in areas with limited broadband access, or internet prices are exorbitant and unaffordable. And finally, people lack digital literacy. They did not grow up using computers and technology and find it disorienting and confusing. So the goal in fighting these disparities is to make sure that we're providing digital education to all consumers. We're making sure we leverage federal and local programs to increase access to technology devices, and we work with the FCC to increase broadband and make internet affordable. So the future of healthcare is really hybrid care. A lot of people think telehealth is meant to replace in-person care, and that is certainly not the point. Telehealth is a vehicle to increase access and convenience to care. And telehealth with in-person care can provide a holistic, comprehensive care coordination process. So when you think about, for example, maternal health care, women have to go to the doctor on regular intervals. A lot of women miss these prenatal appointments because they can't take the time, they don't have the transportation. Virtual care can be provided for some of these services. You can have a home fetal monitor and send that information to your doctor. You can talk to your doctor about your prenatal diabetes, step on a scale to let them know that you're not retaining weight. So there's really ways to provide healthcare virtually and still go into the doctor and see a doctor on a regular basis. So telehealth in and of itself can sometimes replace in-person care, but really a holistic approach is combining in-person care with virtual care to make care seamless and much more accessible. So digital literacy is an essential component. It is a super determinant of health because it is the fact that it is the way that everyone accesses information. So if you do not have digital literacy, you don't have an ability to access the internet. You don't know how to navigate and find jobs, find educational opportunities, find housing. So including healthcare, without digital literacy, you really are stymied in your ability to access healthcare services, as well as access opportunities that can help you improve your circumstances in life. So without digital literacy and the ability to use computers, you really are unable to better your circumstances. So the future of electronic prescribing of controlled substances is essential to treating substance use disorders. During the pandemic, we discovered that the electronic prescribing of substance use disorders increased access to medications for opioid use disorder tenfold, probably even more. And so without these tools, people cannot access the treatment they need that is evidence-based. This is especially true with substance use disorder because of the stigma associated with receiving care. Especially in small communities, people do not want to be seen going somewhere to get medication for opioid use disorder. By being able to get the medication virtually, they are able to consult with a doctor, get disease management and control through consultation, and also get the medications without having to leave their home, and that has proven to be increased compliance for medications. Also, controlled substances are not just for substance use disorder. For example, Adderall and other medications for ADHD are controlled substances. There are plenty of patients that live in areas where there is a shortage of pediatricians, and the shortage of pediatric psychiatrists is well known across the nation. So for children to be able to access the information, the medications they need to perform academically and to be successful in schools, not allowing them access virtually to electronic prescribing of ADHD medicines is sentencing them to struggles in school, struggles with relationships with colleagues. It really is a tool, an essential tool that every child should have access to. Telehealth is essential for care coordination and chronic disease management. First of all, it allows the provider to provide a continuous set of care. We know that telehealth allows reduced no-show rates. Telehealth increases compliance with medication management. It's been very effective in supporting chronic disease management for patients because there's an easy way to interact with your doctor. At the same time, chronic disease and mental health issues are much higher among those that have more limited resources. And so telehealth offers an opportunity for providers to come into the patient's home, literally and figuratively. Sometimes it's a nurse or a community health worker with the patient with the video camera. Sometimes it's just talking to the doctor directly through an electronic device. But the doctor is able to have a conversation with the patient in the patient's own home where they feel comfortable discussing issues related to social determinants of health. They also, doctors are able to review and see the environment in which the patient lives and understand, are there issues related to, the safety of the environment? If the patient's asthmatic, is there mold going on? They can ask the patient directly what kind of food is in the refrigerator and show them. It really gives an insight view into the person's lives versus having just a random survey that the patient is completing in a doctor's office. So we are in the middle of a behavioral health epidemic. We know that during the pandemic, not only was COVID spreading, but there was a growing rates of depression, anxiety, as well as substance use disorder. Telehealth is the way to reach these individuals. There's a shortage of healthcare professionals across the nation to meet the needs of people with behavioral health. And the access to telehealth enables access to care from the comfort of your home, from the convenience of wherever you are. It also allows access to safe spaces to talk about your health, to reduce stigma. During the pandemic, we did an analysis of all Medicaid claims in Arizona, and what we found was people with serious mental illness, this includes bipolar, schizophrenia, lived in a lot of areas that were so far that it would be 2 hours to travel to the nearest behavioral health provider to get services that they need. So without telehealth, these individuals would not be able to manage their condition, and they'd probably end up A, unemployed, B, unable to function, and C, probably needing acute care services at some point in their lives. CMS flexibilities for telehealth are essential. They've transformed our use of telehealth in the United States of America. First of all, the ability to practice telemedicine from a patient's home has increased convenience and access to care. Second of all, reimbursement at payment parity has allowed providers to decide whether telehealth or in-person care is necessary. And the providers should be able to use their clinical judgment. When you think about telehealth, you think about the time the doctor takes, their clinical judgment, their expertise, as well as the fact that they need staff to help support that telehealth visit. The same admin staff that are in the office are doing getting the patient onto the video camera, making sure everything's working. And as we talked about this hybrid care model, telehealth is not just virtual care. We also need a combination of virtual and in-person care. For example, the doctors need an office where they can go to do those in-person visits. They need the equipment in the labs for services. If you look at surgeries, you can do the pre-surgical consult remotely, but then the person has to come to the office for the surgical consult surgery, and then they can do the post-surgical consult from home. The doctor needs to maintain that space. So without payment parity, providers cannot continue to offer this hybrid approach to best meet the needs of the patients and accommodate their needs. This could compromise access to healthcare, especially among the more vulnerable populations who are less likely to access healthcare because of barriers such as transportation, conditions that affect their ability to travel, such as pain, or disabilities, as well as other conflicts such as day jobs that do not allow the flexibility to take a doctor appointment. And there's plenty of caregivers with children or older adults that are unable to make arrangements so that they forego their own health care to take care of their responsibilities.